How are you?
Oh, fine, fine. You too?
Yeah. We are really glad and we're really honored that having you in this Congress is a great opportunity for us. Just to let us know what you think about osteopathy and your last research that you told me was on the brain.
Okay. So tell me when I start now or what?
Yes, you can start.
Okay, so I say hello to everybody. For me, it's very nice to meet Philippe, and also to have this opportunity to have some international connection. It's so important. It's a big community, osteopathy, and it's nice to meet people from South America. I'm an osteopath since 50 years, so now I'm still trying to improve myself because, we don't know so many things and it's important to work a lot. I'm a fan of anatomy, we'll speak about it. I still treat patients. I have wrote about 18, 19 books, something like it. And I was very lucky because to be an osteopath, I was a physiotherapist and I work in an hospital and I did a lot of dissection. And it was interesting. It was during my study of osteopathy. Donc, each time I learned something, I tried to check on the people, on the cadaver, what was. So, there is a difference for me between osteopaths and osteopathy. We have a lot of people using some techniques of osteopathy and they say they are osteopath. It's a little difference. You can use a technique of osteopathy without having this concept of steel on the philosophy. And remember that steel says the most important things are first anatomy, second anatomy, third anatomy. We cannot avoid anatomy. Even if you have any kind of different ideas than the other, anatomy is a link. We cannot avoid. I am a fan, of course, on what I said, and I have a lot of all books of anatomy, very precise on description. It is not so much design. And so I treat patient on any kind of patient. I'm not specialized in visual because specialization for me is a mistake. We are generalists. We must treat all the person. And as all the body is connected, I wonder how you can be specialized in a part. Okay, I'm very proud to be a manual therapist because in France, some people have the complex of medicine. And for me, to put your hand on somebody is something more important than to take a needle and to put some drug and some injection, even if sometimes we need, it's more important and more difficult. So very proud to be manual therapist. And I try to push people only to use the hand, not to use something else, because when we do a diagnosis, we don't interrogate so much the patient, we interrogate the body of the patient. And the body of the patient has a long life. And each thing is stored in the body. And sometimes you are surprised because you can find that the person doesn't remember. So when you speak to somebody, he will try to attract you to the symptoms, of course. He has a shoulder problem and he wants you to touch the shoulder. He doesn't want you to do something else. And after to say, maybe your shoulder comes from something else, I will interrogate first your body. And after I will interrogate you. The body show me something, suppose liver or dorsal spine. I say, well, there is something connected with him. I prefer to trust your body than yourself. Alors, at the beginning, no, they know me, they accept. At the beginning, it was a little difficult. And we have a big difficulty in osteopathy is to avoid the symptoms. It's not so easy to avoid the symptoms because my whole profession of physiotherapist was to follow the symptoms. When you're a doctor, you follow the symptoms also. So little by little, it took me about 10 years to try to avoid the symptoms. So when you do a case story, when you interrogate the patient, little by little, the patient becomes the dominant person and he becomes a therapist because he wants you to be in a part of his body. And little by little, he gives you the message. I take the example. I have a shoulder problem, and he will repeat shoulder, shoulder, shoulder. And in your mind, after, the shoulder becomes the most important thing, and you will avoid some other thing. We are against specialization. What I say, if you do some cranial techniques on cranial therapy, the skull is connected with the thorax, with the abdomen, with the legs, and so on, and you cannot differentiate the skull and the brain from the other part of the body. To give you an example, one of the most important things for the skull is to have a good pressure, a negative pressure of the thorax, and a positive pressure of the liver. For instance, if you take the venous system, for instance, venous system will give the negative pressure of the thorax to the vein of the brain. We have about 2,000 kilometers of arteries and vein on the brain, and there is a sucking effect which permits to the brain to be less heavy. Of course, the cerebral spinal fluid has a big effect also, but not only. And if you take a baby with a plagiocephalia, for instance, if you treat only the skull, you will miss a lot of things. A bad position of the baby is a bad position on the thorax. It's a bad position on the leg. If you have a tension of the thorax, for instance, the right side, the pressure of the right side of the thorax will create some problem on the skull. So we must, of course, treat the skull, but don't forget also to treat the thorax. And the message I always try to give to my students to say, you must start from the point zero to the point to the top, and not to say that my message is a brain is important, but without a body, I don't know what is a brain, and a body without a brain is nothing also. So we must be totally complete. We insist also on the differential diagnosis. If you take the cervical spine, for instance, it's a compensatory system. And most of the cervical spine is connected with, for instance, the teeth, the eyes, the ear, the thyroid, the esophagus, and so on. So you have many causes giving some fixation of C5, C6, because it's quite often C5, C6. And if you manipulate the cervical spine and you forget, for instance, to check the lymph node or to check what I say, the eyes, the ears, you will do a manipulation, it will come back. I was not a good osteopath at the beginning of my career, I can say, because I did not understand so much, and my results were not so good. I'm very honest myself, when you are good, but and it took me about 10, 12 years to little by little to accept the principle of steel and to accept that there is something else that only the spine. I did my study in Maidstone, England, and the study was about the spine. I know how to manipulate any part of the spine, but nothing on the skull, nothing on the organ. And when I was at the hospital, specialized in lung disease, I noticed that on the side of pneumothorax, what we call therapeutical pneumothorax, the cervical spine transverse were deformed because the tension of the pleural attachment created a deformation on the cervical transverse. So it was so important for me to check that the tension of an organ like the lung, like the pleura, is able to deform a cervical spine. And of course, the patient at this time got some neuralgia, and the biggest problem was not to treat the neuralgia, but to release the cervical attachment to the cervical spine. So finally, what I did at the hospital was very interesting. And my dean at this time was somebody so smart and big culture. He started to work. So you see me again or not? Well, okay, you see me again. D'accord, it was just... after, so the notion of good health is important also. Nobody is in a good health. Or you are in a good compensation adaptation, but not in a good health. If you take the example of somebody You have genetic. You have the parents, the grandparents with something that they can give to you. You have the fetal position. You have the delivery of the mother. You have the vaccination. You have the infection. You have the trauma, physical trauma, emotional trauma, bad diet, pollution, social tension. So we are all this little part in ourselves. If you're in good health, you compensate, you adapt yourself, you have no problem. If you're in a bad health, little by little, you are sick, and the illness will declare one time and another time. And it's why in our job, we try to stop a little different things. We can work on a fetal position, for instance. We can work on after delivery when there's some tension on the arm or some tension on the brachial plexus. We can work on physical trauma. We can work on the organ also. Genetic, we cannot change, of course, we cannot change. Infection is not so easy to change a little bit. We can give some advice of diet, some advice also of to relax a little bit. So we have a big role to play in osteopathy and to help the patient if we overtake the limit of what we see. Because what I said before, you see a patient, but you see the life of the patient, the entire life of a patient. And it's nice because I have a lot of friends who are medical doctors, and very often they get bored a little bit. We have this chance to have something so good that we can do and so exciting because we know the limit. We try to push the limit. What I said before, after 50 years, I still learn a lot. And I hope it will last a long time. So you have some people boring in a kind of job. In France, very often the physiotherapy are a little boring. They don't like when I tell them this stuff. But we have this chance to have something so important to discover. I wrote a lot of books because I used to see so many patients in my life. And I would like to share a little bit when you write a book. It's not for your ego. After a certain time, you overtake the limit of ego. It's to help a little bit. And it's good when you write a book. It's a base of something that you can, after you can go elsewhere. My last research was on the brain. And it's difficult for us to understand what is the brain. I was lucky to meet doctors, professor, PhD, specialized in brain, and they are very modest. You know, the people, when they have a lot of knowledge, they are modest. And the brain is something bizarre. It's a structure which is able to think. And nobody knows how you can think, happily, because we need some mystery also. So what we can do on the brain? The brain is important for the pressure. We can act on the pressure on the brain. We have the lymph system, the lymphatic system, we will see after. We have the arterial, the vein, and also the lymphatic system of the dura. And there is a balance between all these elements to permit to the brain to have a pressure of about 12-15 millimeters of mercury. And each time you have a change of pressure in the brain, you change all the physiology of the brain and even all the hormonal and chemical production of the brain. So for me, the pressure of the skull is the most important thing. Honestly, I don't believe that the skull is moving. And more my colleagues follow me a little bit. I believe that there are some change of pressure with a certain rhythm that you can feel with your hand, but not able to dilate some bone. One time I did an experience. There was a guy of 90 years old, and I checked the skull and I found flexion, extension, as everybody can find. He died 3 weeks after, not because of me, but he died. I did the dissection myself. I opened the scalp, checked the scalp. There was no one suture. Everything was totally calcified. no movement at all. It was 6 hours after the death. Impossible to move the skull. So I say, I found this movement inside. What is this movement? If you take a box of iron, and inside you put a liquid, and you move the liquid, come back, move the liquid, with the hand of the iron, you will feel this fluctuation. On what I do believe myself, and I respect the people who don't believe the same thing, what I do believe myself, what we feel with the hand, what is called flexion extension, is a change of pressure inside. A lot of physiologists and medical doctors are working on this pressure. And I was lucky to meet different person, very known in research, like in France, we have some national research medical company. They are very known. And I explained a little bit what we found with the hand, saying that I don't believe the movement of the skull, but I believe the movement of the inside the brain. And they say, yes, there are two things which are very important. Cardiac pulses, when the heart contracts itself, it gives the direction of the fluid, of the cerebrospinal fluid. On inspiration, of course, the deep inspiration gives a big movement on this movement of the fluid inside the skull. And I'm still in contact with the people. And they say, you know, Jean Pierre, we believe what you do. We believe that you can do something in the brain, but there is no machine able to feel what you are feeling. Because I did some MRI, of course, I did some functional MRI, I did some CT scan and so on. And what we feel with the hand, there is no machine able to do. For me, to do osteopathy, you must do listening, because the body is more important. We treat the body, we don't treat something else, we treat the body, and the body is more important to feel. Listening permits you to connect the tissues where the problem. We have some structural listening, we have some emotional listening, some functional listening. And functional listening is very important. I take an example. You put your hand on the head of somebody, you ask the person to smell something, you feel at once where the brain receives this smelling information when you put your hand. It's what we call functional, and sometimes after trauma, you have some anosmia, and you can find which part of the brain did not receive this message. So we try also to do some research on the lymphatic system. You know, at this time, there have a lot of mystery again, because we must be careful not to have the information Wikipedia or internet. You have a lot of people, when they write something, it's only Wikipedia, internet. And it's surprising because 10 years before, I read some stuff about internet, and no, they said that it's false. So we must start from the hand, then we feel something, and after we try to feel to check what is, and not to start from information, internet information, and try to put this information in the brain, and after say yes, I feel this stuff. The GLIM system, since a long time, I remember my dean say, Jean-Pierre, there is something in the brain which is able to evacuate the waste, to carry the hormonal system and so on. I say, I'm sure there is something, quite a lymphatic system. It was a long time ago. It was about 30 years ago. And now they discover this lymphatic system, which is most of the time connected around the big trunk, like jugular vein, like internal artery, carotid, and follow the big trunk, what we call the Virchow-Robin space. And there are some cells and also some glial system at this level. But what is interesting, now they say that 40% of the production of cerebrospinal fluid is done by the brain. And for the evacuation, it's not only the sinus, venous sinus, we have the ethmoid plate, okay, which plate, the eyes, okay, the eyes, and certainly also you have the ear, they think that there is something on the sinuses. So we have some research were done nowadays, trying to prove that all these parts are important in the skull. For instance, when you have a trauma, you have a big shock. On the shock, the brain moves inside the head. On the brain moves, and you have some collisional forces turning around. The compensation is the eyes. The eye move outside. The tympans move outside also. And a big part of this collisional forces go to the spine through the foramen, occipital foramen. And it's interesting, when a long time ago, there was a lab connected, close to Lyon, specialized in a car accident. They put some pigs on it. Awful. Now it's forbidden. They put some pigs in the car with some sensor in the head, in the thorax, in the ears, and so on. And they crash the pig against a wall at 50 kilometers per hour. And they follow all the collisional forces going inside. It's incredible. They are turning. When there is what we call the heterogeneity of the brain. And when there is something soft, they follow. When there is something hard, they are against what is firm. They come back and so on. And they are turning, moving. So you can have people with coma, and you see nothing on the MRI because it was a destruction of the conductibility of the neurons, which that medicine cannot find with MRI. So I was lucky. Now it's forbidden. I'm very happy for the pigs, of course. And it was because of Brigitte Bardot that it was forbidden. It's a good thing. But it was something interesting for us. How to do something on the lymphatic system? Finally, we work on the viscoelasticity of the brain, because what I said before, the brain is very important, and there is what you call the vasogenic system on all the arteries on the vein, a vasogenic system. We compress a little the brain, we let come back the brain. The brain is like panna cotta. It's very soft, and a little part of change of pressure will create some movement inside the brain, and not in the skull. We work on the jugular vein. We work on the carotid. We try to find where there is an abnormal tension following, for instance, the internal carotid. There is also a siphon of the carotid. We try to make the same movement as the siphon of the carotid to check on both sides if there is some difference. We check, of course, the jugular vein on carotid as a thoracic outlet. And we do some treatment also, starting from the heart, tracting also the jugular vein, and pushing a little the atrium down to change not only the pressure of the artery on the jugular vein, on the carotid, but also what is around. And what is around is very important. On the connection of the fascia of the thorax, finally, the connection with the dura, the head, is the vascular system. On the vascular system, for us, we can help a lot. For instance, we are for the arterial system, vertebral artery, on the internal carotid. We can work on the internal carotid, make glide we can work on the vertebral artery, making glide the artery inside the foramen, the transverse foramen, making glide the artery between occiput C1. Remember that this artery must move about 7 millimeters when you turn your head from right to left. And most of the time, when you have a trauma, there is no movement. And after, we work tracting a little bit with the maxilla on the ilion, for instance, asking the patient to move the arm to create a traction on the vascular system, which go to the vertebral artery, and we do it on both sides to balance. For the carotid, we work on the sinus, on the glomus, just behind the gonion. There is a bifurcation, and we try precisely to be also on the carotid. After, We work with Q-tip on the ethmoid. We work with Q-tip on the sinus, putting a little up and after down direction of the concha. Yeah. We work also on the eyes, because you know, when you have a trauma, for instance, when you have edema of the brain, this edema follows the optic nerve and goes inside the eyes. Is a part of the brain, totally a part of the brain. And we work on the eyes to permit also to have a better illumination and better movement on the cerebral spinal fluid. So we have so many things that we can do if we avoid to do stupidly only on manipulate C4, T4, on, which come back each time, as you know. So we have so many things to do and a lot of things to discover again, because very often the students say, but the old people have done everything in osteopathy. No, we have done nothing. I'm sure that the young generation is very important for me, because they are the person who will discover a lot of things. If they have the personality to avoid, you know, what they call evidence-based, for me, it's so funny to, we must not imitate the doctor, the medical community. Evidence-based, I take you an example. In France, they have done some research about low back pain, L4, L5. And they do manipulation, of course, of L4, L5 sacrum. And they say, but no, it doesn't work so much, but like the placebo. But you can have L4, L5 because of kidney, because of knee, because of intestine, because of feet. So if you take the concept of osteopathy, which says that everything is important, we avoid this problem to L4, L5, the disc. Everybody has the tension of the disc when you see the X-ray. It's normal that you have a disc a little flat. So it's why if we follow the concept of osteopathy, we cannot do some research with a medical concept. It's not possible, because all the body is important.
The paradigm is different.
Ouais. So it's why it's alors it seems that there are two parts of osteopath. The osteopath will follow a little more the symptoms, who are a little physiotherapists, a little better, not sure, sometimes that physio. And the other one, a very small amount, we say that we are osteopath, we must avoid the symptom, we must be aware of what happened inside the body, and that is nice. That is nice, and it's what I like to connect people with the same spirit of us. And it's not so easy, because you know, in France we are recognized as osteopath. We have a diploma recognized by the state. It's the worst thing you can imagine. We cannot manipulate cervical spine without a medical prescription. We cannot touch a baby under 6 months old. You can imagine, maybe 5 months old you cannot touch. 6 months on one day you can touch. That is very important. You cannot do no urogenital manipulation by internal way. So of course we still do it and we have no problem, but that kind of recognition is against the principle and the concept of skill. And what I said before, what kind of recognition we have. And I'm not sure that is the best thing to be recognized. Maybe for the school, but as a therapist, I'm not sure that on the school, little by little, they follow what the government is saying. They must have evidence-based research. They must have a plan A, B, C, number of hours. We saw, for instance, there are nothing, no skulls, they have nothing, more on the spine, for instance. I was a teacher in the Faculty of Medicine in Paris, myself, and so at the end, the people were not so, they were only interested to quacking a little bit, to quack a little bit the spine. But they give up the skull, they give up a little the organs, so it was desesperating somewhere. But it's not a problem. We have patience. We want to help the patient. We want not to do a lot of sessions. For me, 2 sessions, 3 sessions maximum. Because what I say to my patient, don't spend my money, your money with me. You must see somebody else if you are not improved. And to have the recognition of the patient is the most important thing. That what I think myself is the most important thing. So it's why it's why I say I feel good in my job. I'm still very enthusiastic when I give a course myself, because I know that I have seen maybe more than 100,000 people, different people in my life. So I know that we can help. I know that we fail sometimes. If you don't fail, it means that there's something wrong in your head. And when it works, it's wonderful. You help a patient in his life. What do you want else? Okay. So do you have some question to ask me, or not particularly?
I think, yeah, the most important thing of this is that even I didn't know you by person, and we are not coming from, I'm not one of your students, but we think and we think in general here in the school in the same way. We choose to take a chance, not only in basic medicine, which is now it's like a dogmatic way of work, and we have to take care of that and be and talking the same language with the ones that prefer that kind of medicine. But in osteopathy, we like to take a chance to what still says or said, that was anatomy, first anatomy, second anatomy, after anatomy, and knowing everything about physiology and discovering ways of treating with the hands. So one question I want to do is the important thing that what you do when you face, maybe with your name like Barral is pretty easier than me, that nobody knows me really. But when you have a discussion or professional discussion with a medical or a doctor, when you talk about these kind of things, like I know I'm going to treat the brain, it sounds like heavy stuff. Sounds like maybe with a neurologist, maybe they are not open, so on my open mind, so they can understand the concept of not treating exactly the head, and you're going inside, and maybe you can reach the same place, and there are a lot of pathologies that you cannot treat, and there are a lot of pathologies that they are treatable by osteopathy. No? So what is your approach with that neurologist? You try to avoid, or you avoid doing the whole speech, or you really try to tell him everything?
Understand what you say, because I work with neurologists, of course, and I work with them. The problems are, you have two things. You have what we call what is quite objective. You can work on the artery, for instance. You can check the blood pressure, and you can see if you increase a little the circulation. You can work on the venous system. You can work on the muscle of the brain. You know, for instance, the pterygoid muscle is the most important muscle to maintain the head pressure. That is funny, huh? So we can work on this muscle. On the temporal muscle, which is important. So on the ear, we work on the ear. For instance, you have on the ear inside, you have the vagus nerve, and we work on you have the trigeminal nerve and the facial nerve inside, with how they call some little coton-tige, how they say, Q-tips, with Q-tips. Okay, you can work inside. Well, Q-tips. We can work on the nervous system, on the trigeminal system. For instance, when you take the scalp, for instance, the scalp, you have the nerve, trigeminal nerve. This trigeminal nerve is just at the superficie. It's a nerve of the dura, of the fox, of the tentorium cerebellum, of the arterium, the vein. It's difficult to do more on this. We can have, we can treat this nerve on the scalp, very focused, very often around the coronal suture. So you work on this nerve. You can work on the supraorbital nerve. Infraorbital is infraorbital also. It's not so difficult. We work also inside, for instance, the mouth with a pterygomandibular pathway and so on. So we say we have something objective that we can do, objective. After, we have something functional. Functional is different. It's based on listening. When you have a Parkinson's disease, we will never change the Parkinson's disease. When you have somebody with multiple sclerosis, you don't change the illness, we are sure. We try to help the patient. And sometimes it works. You can, the patient is able to walk a little more than before. So when you say, I don't want to lie, I just do my job. And I say to the guy, if you want to lie on the table, I show you a little bit what I'm doing. And myself, I hate esotericism. I'm not a guru because honestly, you can easily be a guru in life, but there are so many things that we don't know that I cannot be a guru myself. And you say, well, what I feel is this and this. If you take a person with a trauma, real trauma, with some transient ischemic problem, you put your hand in listening, you never do a mistake. You feel exactly where it is. It's occipital, frontal, and so on. You can do a mistake sometimes. Is it a tumor? Is it a cancer? You don't know. You feel something. We feel the structure which have a problem. And they were very surprised because we did the experiment without seeing the MRI with somebody with some real stuff, saying that at this location there is a problem and you give the size. During 30 years in Grenoble, I organized some free treatment for disabled kids. So disabled kids, about 100 kids each year. So disabled kids have something real in the brain, absolutely real, but you find it. For instance, even agenesia of corpus callosum, you can feel it. You can. So it's why I'm no doubt about the diagnosis. Sometimes the treatment works, sometimes it doesn't work. What I say about the pressure in the brain, you have difference of density. On difference of activity. The brain is not something unique. For instance, the frontal area works more than the other part, for instance. And there is some difference of density that you can have in life because of trauma, because of infection, because of so many things. But you feel this difference of density, and finally we work on the density, we try to release. So it's the mystery will, of course, will stay, because if the best researcher in the world says there is some mystery of the brain, and happily what I said before, because if you have no mystery in the brain, everybody will vote for the same person, everybody will think about the same person, that happily it will be mysterious, but there is some part of the brain that we can treat quite objectively. When you have an aneurysm, it's very easy to feel the aneurysm. Of course, you cannot treat the aneurysm, but you feel the consequences and you try to work on the consequences of the aneurysm. And it's incredible to know how the brain is sensitive to pressure. That is, when you sneeze, for example, when you cough, what I said before, you have about 12 to 15 millimeters of mercury in the brain. When you cough strongly, you have maybe 80, 90 pressure, millimeter of mercury. And you feel, sometimes your eyes are moving a little bit and you feel some star around the eyes. So the brain is very sensitive to pressure. And a lot of people, for instance, with stroke, is when they go to the bathroom. The ones they have constipation, they push a little bit on the way. Very often the family don't say, because of course it's not something that you want to say to a lot of people. So when they do some sexual activity, very often there are some people who die because the pressure increases. So it's why, for me, the master word is the pressure, to play on the pressure.
Yeah, I get it. It's great to having you here. And well, do you want to give a message to the new? We will have a lot of students in the Congress. We will have also a lot of professors, but we will have more students. and physical therapists that are beginning or thinking about the initial concept of manual therapy. So what would be your advice to them?
But my advice, well, you know, my advice, without working, you cannot be good. Nobody is talented. We must work and to have a talent. You can be more or less sensitive, that is a problem. But if you don't work, it will never work. So there's one danger, the routine. Because you need sometimes a routine. You have some people who do a routine, but after when you have a routine, a too long routine, you do always the same thing. So to not to stop the link with the medical community, because it's important for us to speak with the doctor. That is very important, because when you have 42 degrees of fever, you don't see an osteopath. You take maybe some antibiotics, and it's not so bad. So it's why we must be careful. Anatomy, the morning before the first patient, 2 minutes, they take half a page of anatomy, because when the evening you are tired, the morning you are good. And you do it 360 days a year, and you will do a lot of anatomy. After trying to work with the radiologists, because they are good in landmarks, they are good in anatomy, the radiologists, better than the doctor, better than the surgeons, most of the times. And after, so to say that they can have a little group, to work with some little group, when you have a course with you, and after when they live in another country, they know another town, they can have some little group to avoid the people who are arrogant, because an osteopath arrogant, you must kill this guy. And you have so many people like, okay, so they must avoid. And modesty, because when you treat people, when you teach, and when you're only teacher, you are no more modest, because you always work. On the whiteboard, I can treat all the world. But when you are in front of reality, it's a little different. So we must fail, what I say, because we cannot know everything. It's normal, and not to be so sad because you fail. Not to be too happy also when you are successful, because we must have a balance between two, and to stimulate a little the sensitive system with music, with painting, with any kind of, because we are sensitive, we must have a sensitive hand. And that is advice I will give. You always do some mistake in your life, but it's normal. When you do some mistake, you must know that you do some mistake and change, and not to perseverate in that kind of stuff. So after 50 years of practice, and honestly, you become good in osteopathy when you are going to die. So you start to be good. But after 50 years, I'm very enthusiastic, because we are so lucky to have this job. It's a lucky job. A lot of people, they get born when they work, and we have something wonderful. The hand, what I said before, everybody can put a needle, but the hand, to feel what is underneath, is more difficult.
Absolutely. I'm really glad and also listen to your advices. It's something that makes a lot of sense. And I would try also to avoid being arrogant, and try also, if I fail, not to be so hard on me.
Well, of course.
Because everybody, we fail sometimes. But I would like to thank you to take 1 hour of your time, and take care. We're in a kind of emergency condition, at least in Chile. I know in France maybe you are a little bit better, but we have to take care, and we want to have a lot of books and a lot of courses of Barral.
Okay, but one time we will meet, I'm sure.
Yeah, absolutely.
So people told me that you're good, donc Felipe.
Okay. Thank you very much, Jean Pierre.
Okay, bye-bye.
See you there.